Hi class, this is Professor Tabor. I am just going to do a short presentation on bone fractures. By the way, welcome to Adult Health 3. Throughout the course, I'm going to provide a variety of different resources for you guys. One of the resources being recorded lecture in addition to classroom lecture and discussion and other modes of learning that will take place. So this is relatively a short presentation and we'll get started. So bone fractures these are breaks or cracks in a bone. Bone fractures can be from trauma, such as a fall or accident. It could be from twisting injuries. Now, remember that anytime that a patient has a twisting injury that results in a fracture, you need to rule out abuse, especially if it is a younger patient. Also, diseases can cause bone fractures such as cancer and osteoporosis. Now, with cancer, you may see high calcium levels in the bloodstream. And what's happening is that the calcium is leaving the bone and entering the bloodstream. So anytime that you see a patient who has extremely high calcium levels, especially if the patient is a cancer patient, then this could be an indication that they have bone cancer. And sometimes it's from metastasis to the bone. And this is something that happens more often in some cancers than others. Just for an example, prostate cancer that is extreme, it's in its extreme stages or later stages, can sometimes metastasize to the bone, such as the spine. Osteoporosis, of course, is a condition where calcium is being lost, and you would expect low calcium levels, and this is common, of course, more so with women. We're going to talk more about osteoporosis a little bit later. Also, children tend to heal faster than adults because their periosteum is stronger, thicker, and more flexible than the periosteum of adults. As it relates to healing times, usually again 3 to 12 weeks, but there are possible complications associated with fractures, such as infection. And a bone infection is referred to as osteomyelitis. We're going to talk about osteomyelitis a little bit more in class, but osteomyelitis is often difficult to treat. Oftentimes patients need long-term antibiotics, and they will most of the time require some type of long-term venous access, such as a PICC line or a port. Also, compartment syndrome is a complication, fat embolism is a complication, and nerve damage. Now we're going to talk a little bit more about these a little bit in the slide set and then a little bit in class. So these are all signs and symptoms of bone fractures. So just remember broken. It stands for bruising, reduced movement, odd appearance, crackling. When bone fragments rub together, that's what causes the crackling. Edema and neurological damage. Now there's different types of bone fractures. You have open versus closed. The only difference between an open versus closed fracture is that an open fracture breaks through the skin. The bone breaks through the skin. A closed fracture is considered a simple fracture where the bone does not penetrate the skin. Now it's important to know if it's open versus closed for multiple reasons, but one of the big reasons is that the risk of infection is much higher with those types of grotesque open fractures that you often see mainly associated with trauma. So you have to ask the question, is the bone completely broken or part of it broken? So a complete fracture is when the bone separates into two. An incomplete fracture is when the bone does not break the bone all the way. The fracture does not break the bone all the way through. That's the difference between complete and incomplete. So when I'm talking about these different types of fractures, I encourage you guys to, pull up a search engine and Google these types of fractures to look at photos as well. Also, you need to look at the details or the patterns of the fracture. A green stick is when one side of the bone is bent while the other one is broken. This is an incomplete type of fracture, and it is the most common type of fracture in pediatric patients. I would remember that. A comminuted fracture is when the bone is broken into many fragments, and the actual definition is 3 or more fragments. The other is distinguishing between transverse fractures versus oblique. With a transverse fracture, the break is straight across the bone shaft. It is a clean break. With an oblique fracture, it is slanted across the bone shaft. That's the difference. Again, you can look at photos. A spiral fracture is when the fracture twists around the bone shaft. Most of the time, spiral fractures are associated with twisting injuries. Again, if you have someone who has a spiral fracture, you need to investigate to see what led to this, because most of the time, spiral fractures are fractures that can be associated with abuse, and it could be associated with other types of injury that may be associated with violence. These are the 6 P's associated with bone fractures: pain, pallor, paralysis, paresthesia, pulselessness, and pyochilothermia. Pyochilothermia is basically the alterations in temperature. Now, one of the things that you need to do as the nurse is that anytime a person has a bone fracture, you need to be comparing the affected extremity to the unaffected extremity. So in other words, you would be assessing for color, pulses, temperature from one extremity to the other. Other nursing interventions includes immobilization of the fracture. You should splint the fracture above and below the fracture itself, like if you witness this in the field. You need to stop bleeding if there's any and apply pressure with a clean cloth. If the fracture is open, it needs to be covered with a sterile dressing, because these patients are at high risk of infection. You need to elevate the extremity to decrease the swelling, apply ice, and you need to keep the patient NPO until evaluated by a physician. The reason that you need to keep the patient NPO is in the event that this patient needs to be taken to the operating room. You need to do pain management. You have to do frequent neurovascular assessments, because these patients are at risk for compartment syndrome. One of the telltale signs of compartment syndrome is when the pain is getting worse even with treatment. So we're going to talk about compartment syndrome. Pain is the earliest sign of compartment syndrome. Pulselessness is the very latest sign, or a late sign of compartment syndrome. It's not actually the latest. The latest sign of compartment syndrome is death of the limb. So you need to make sure that you keep the extremity elevated above the heart, loosen and remove restrictive clothing, notify the physician. If a patient develops compartment syndrome, they may need a bivalve cast. A bivalve cast is a cast that allows pressure to be reduced. If a patient has compartment syndrome, and if it's not treated within 6 hours, the patient may lose their limb. Also, a fasciotomy may need to be performed to relieve the pressure as well. Again, compare and contrast the affected extremity to the unaffected extremity. A fat embolism is associated with long bone fractures. Remember that. It may be associated with changes in mental status, restlessness, or increased respiratory rate. If a person has a fat embolism or fat emboli, one of the symptoms that you're going to see is changes in the quality and quantity of their respirations. These patients may be tachypnic, but they also may have desaturation as well. There's various treatments for fractions. Bone reduction is one of the treatments, putting the bone back into its original position. It can be closed or open. Closed is when it's done manually. Open is when it's done surgically. If a patient has a cast, you need to assess for the 6 Ps, assess for any hot spots on the cast, assess for any smells or signs and symptoms of infection. You need to make sure to use the palms of your hands when caring for a cast, a new cast, with a patient. The reason you need to use your palms rather than your fingertips is that your fingertips can cause dents in the cast, which may cause pressure ulcers to develop. You need to keep the extremity elevated, never place anything in the cast, and if the patient develops itching, then they can be prescribed antihistamines or a hair dryer placed on the cool setting. The cast needs to be kept dry. Surgical reduction can also be an option. Either an internal or an external fixation device may be needed. Anytime that a patient has traction, this is done to keep bones aligned. You never remove weights from the traction, and weights should not ever touch the floor. The patient will also need a trapeze bar. The trapeze bar helps the patient participate in activities of daily living, such as repositioning, and you also need to do good skin care. This completes the presentation. Again, I look forward to seeing you guys in class, and if you have any questions, please let me know.